An epidemic that does not discriminate.
More Americans died from opioid overdoses than died in the entire Vietnam War.
It could be your friend, your neighbor.
An addiction that often has its roots in a small piece of paper we all know simply as a prescription.
The problem of opiate abuse has gained a lot of attention because of Prince's death.
Little Falls is really where the Mississippi pauses. The river's really right in the center of our town. It's been a town that's lost a number of large businesses that took a lot of jobs away from our area, and I think for the most part we're coming back from that, but most definitely that loss and that economic impact has made a big difference in the town and the community and really in our whole county. A couple of years ago, I really wouldn't have felt that we had an opioid problem. I think that we were all quite naive as to what was going on.
When I was 18, I got in a car accident and I tore my ACL in my knee and I broke a bunch of bones in my foot, and I got the painkillers and I loved them. I loved the way they made me feel. I didn't look like the typical addict, so it was pretty easy for me to keep getting prescribed the painkillers that I was prescribed.
I think I had a surgery. They had given me pain medication for that. And I didn't really take it and was fine after the surgery. And then I still had some from that surgery. And my back was hurting one day and I took one and I felt great. After that is kind of when it went downhill.
Were you taking more
than I should have been? Yes. I would say 5 or 6 a day. But you can have a bottle of pills in your purse and nobody has to know. Nobody knows. Nobody has to see that you take them, and you can be secretive about it.
100,000 narcotic pills or substances were coming out of our 3 pharmacies in this community a month. Not a year, but a month.
We started seeing our prescriptions and narcotics showing up at overdose crime scenes.
So then the red flag really went up that we had to do something about this problem.
I feel our role in the community is to improve the health of the community we serve, be partners in the community we serve. As a hospital, going outside of our walls is important because we can't just be that place where people come when they are sick.
We applied for a grant focused on one target population, patients using narcotics for pain.
To be eligible for that grant, we had to partner with people in the community, such as law enforcement, such as public health, and that's really when all of those key stakeholders came together.
In January of 2015, the Morrison County Prescription Drug Abuse Task Force reconvened after being stagnant for several years. After grant funds were received, we could start the hiring process of the Controlled Substance Care Team.
Our Controlled Substance Care Team is made up of a number of people in our clinic. We have 2 physicians, Dr. Heather Bell and myself. We have a social worker, we have a nurse, and our clinic administrator is also on the team. Basically, our role is to help physicians monitor patients that are on chronic pain medications, to really look at why they're on their narcotics, what type of workup they've had, and whether or not we feel they're appropriate for medications. Our goal is to really do what we can do to help them with their pain, but yet decrease the narcotics coming out of our clinic.
So I just kept refilling them, and just because you're getting it prescribed doesn't make it okay.
I, used and abused for years, for a long time. And once those ran out, I knew friends, I would buy them from other people, and it's scary. Looking back, it just blows my mind, the risks that I took.
The difficulty of a program like ours is deciding who really uses the medication and who sells them. So we are intimately connected to the police.
So my role on the Prescription Drug Task Force is I'm the one of 2 law enforcement liaisons. And what we're able to do is take our knowledge from the street and we bring that to the group. I can arrest these people over and over and over, and I can throw them in jail. We really need to get these people into treatment.
We do everything we can to keep people out of our jail because that doesn't help anybody. You have to look at it as addiction, and we get them to treatment and we get them medications they need.
We actually started to see results with the Controlled Substance Care Team and the Prescription Drug Task Force collaboration early on.
Real concrete evidence that we're making a difference. I feel our specific model is working and we're having success because, we've kind of taken down those silos. We haven't tried to address it strictly from a hospital standpoint. We've really said, hey, we all own a little bit of this.
In the end, the less narcotics we prescribe on the front end, where we're going to save that money is not having so many people going through treatment, not having so many people in our jails, not having so many overdose deaths. I think that this program is scalable, and I think the reality is, with the right funding, where we can have the right kind of people in clinics helping these patients, that it can be like what we have. And obviously, we had a grant to get this going, and we're looking at where we're going to get money to keep it going.
It's a small percentage of the population of Morrison County that we're talking about, but it really does affect our entire community and our entire county.
And it takes the whole community to fix the problem.
A healthcare provider in Little Falls says it's been successful at reducing the number of people abusing opioids. CHI St. Gabriel's Health flew to Washington 324 patients taper off controlled substances completely.
And I can tell you that we literally sat down and Googled to see if we could find a clinic program that had been set up somewhere that we could then emulate. And we could find nothing. We could not find a book, a paper, nothing that would give you any idea of where we should start. And we sat around a table, an administrator, myself, and a nurse, and decided we were going to have to make this up as we went. And we did make it up as we went.
And this is a topic that's near and dear to my heart, which is how do we normalize some of these challenges that we have, so that when you look at someone with a mental health challenge or someone with addiction challenge, you don't see them any different than you would see me as a breast cancer survivor. Think about that. One of the greatest challenges we have is an institutional bias.
I think it's important that hospitals and all communities work together in epidemics, especially like the opioid epidemic. As what one hospital found successful, they can share that with other hospitals, and we really need to share anything we've learned with other communities.
Over the last few years, we've had a lot of clinics and hospitals that have taken interest in what we're doing, and so we've spent a fair amount of time going to those clinics and hospitals and presenting our program.
So in the Minnesota legislative session last year, we were proud to help sponsor and help put forth a new bill that would allow pilot projects to emulate the CHI St. Gabriel's Health model for opioid abuse.
People who struggle with opioid and alcohol and other addictions, how they get care is paid for within this bill.
I'm just excited that one little town can have an idea and that they all come together and make something happen. And then they watch it come to pass, and then other people want to do it. And that's how it works. That's how we bring about change.
I'm very fortunate and very thankful, so appreciative that they're in my town.
I do look at the hospital as a safe haven now. In my experience, there wasn't anything else like this out there anywhere. It makes me feel extremely proud that this is where I'm from. And this is how we as a community take care of issues. We don't rag on drug addicts, we help them. We don't put them down, we lift them up, and we help them be successful.
So when we started this program, it was really to help Little Falls, Morrison County, help the overprescribing of opioids, and then help our own heroin addicts. The fact that it's picked up and it's brought us to Washington and around our state is very important to us, to be able to help other communities do what we've done. Never in our wildest dreams did we think we'd be doing any of this.
I feel like a moral obligation at this point.
I think that's just part of our mission. We're fortunate enough where we've been given two very passionate physicians. And for us to take that outside of Little Falls and outside our walls, absolutely we feel a moral obligation. That's what we're here to do.